Greetings and welcome to AWHONN Insights, the home for candid nursing conversations. Today, we welcome a member of AWHONN's Public Policy Committee and California Section Southern California Legislative Coordinator, Amy Scott. She's a senior consultant for the Women and Infants team within Strategic Collaboratives at Premier Incorporated and has 25 years of healthcare experience serving as a labor and delivery nurse, clinical nurse educator, and perinatal leader. Amy will be giving reflections from her 2025 AWHONN on Capitol Hill experience, along with co-host Jamie Agunste, a nurse educator with over a decade of experience as a perinatal nurse and a 2022 AWHONN Emerging Leader. I'm your host, Bria Anopi-Say. Let's get started. AWHONN on Capitol Hill began in 2018. This year, 146 nurses from 36 states held 170 meetings with staff representing 68 senators and 102 representatives. Jamie, I'm turning the podcast over to you to discuss further with Amy.
Thank you, Bria. Amy, thank you so much for joining us today to talk about AWHONN on the Hill with me and to share some of your experience. So I'm really happy you're here.
I'm happy to be here. Thanks for inviting me. Thank you.
Of course. So you and I went to Washington a couple weeks ago, right, in early May for AWHONN on the Hill. And you have been there, I think, when Seth was asking us to stand up to see how many people have been there, for a number of times. I think you were one of the last people standing, right? Can you tell me how many times you've done this and how you got started attending AWHONN on the Hill?
Sure. Yeah. My first year going to AWHONN on the Hill was 2019. And so it was not the inaugural year, but it was after that. And I have been, however, in whatever form it's been, I've attended since then every year. During the pandemic, we kind of had to adjust as we all adjusted. It needed to be done virtually for a bit there, a number of years. And then by 2023, we were back in person, but I've attended each time. I started with always having an interest in, legislation and how does it happen? How do we make things happen? How do we end up with the bills and the laws that govern our, federally or even at the local level, state, or even, more drill it down locally. And so I was invited to become a chapter legislative leader, legislative coordinator for my local chapter. So I'm in California and I am in Long Beach, and we have a Long Beach, it's like a South LA, North Orange County kind of chapter. And I was invited to join that and do that. And shortly after that, I met with the executive team for the California section and mentioned that I was doing that. And they said, well, we need people for the section. And I was like, I'll do it. I want to do that. I was just all game. I was really excited to take it to a little bit of a more, a broader level, which I feel like is the opportunity with the state. And so in doing that, I was then told, well, in 2019, there's going to be this opportunity to go to AWHONN on Capitol Hill. And I said, I want to go. I'm so excited. And I'd never been to Washington, D.C. before. So it was, I can't even begin to tell you how exciting it was to do it for multiple reasons. It wasn't just going to AWHONN on Capitol Hill, although obviously that was the starring attraction. But it was all the other things that I was able to do in getting to go to DC, seeing the African American Museum for the first time. I came early, spent a whole day, and went through that, and that was just amazing for me. I'm so glad I did that. I did it solo. I just did it by myself to really take in the experience. So that was a huge thing for me. But then it was, getting prepped for actually doing the work of advocacy for AWHONN on Capitol Hill.
I think that that's interesting because I'm pretty sure that 2019 was the first year that I went. So I'm probably 1 year less than you because I think I only went to one of the virtual ones that they did during the pandemic. And I had a similar experience where, I was starting to gain more interest in like maternal mortality and what was happening, kind of like what we realized, which was happening all over the country with, all the women and people experiencing birth-related complications. And I wanted to, do something about it. And on a larger level than what I was doing, at the bedside as a bedside nurse. And I'm in New Jersey. It's not that far away from DC. And I heard about AWHONN on the Hill and I was like, all right, I'll go. I'll see what it's like. I had been to DC before, living not too far away. And I always loved DC. I just find it a place that's, I don't know. I find a lot of like inspiration there, and it's probably not something a ton of people would say, but just like going there, and you just get this like sense of depth with everything, and it just feels really important to be able to go, and it feels very powerful to go and like actually interact with the people who are making decisions every day for our country. And so, 2019 was the first one I went to as well. Do you want to talk a little bit about, the structure of the actual event of AWHONN on the Hill, like what we do the first day? I'm hoping maybe we can cover that to give some of the nurses who listen insight on what we do there and why it's like how they have it set up so that it's not as intimidating or scary as you might think.
Yeah. Yeah. And that's a really good point. I know that my first year, in all the excitement of doing this and being able to come and advocate on behalf of nurses and patients that we care for, I was a little anxious. Like, what's the structure? What's it going to be like? Am I going to get supported the way that I need to be supported? And absolutely. And it's only gotten better. That's something I will say about this, is that every single year improvements are made. We much like, I think that we debrief most anything. We ask everybody that attended towards the end of the second day, what went well? What can we do differently? What can we do better? Those are my debrief questions. And that's really the spirit that we always improve on this experience with. So I feel like that's absolutely a big part of this. So the structure is really, it's typically a Sunday night meet and greet. And you get to know some of the people that you're going to be talking with, meeting with, potentially going and meeting your congresspersons, typically staffers with. So I'll get to that in a minute. So that's a nice little, get to know.
Like a warm up.
The time. Yeah, warm up. Yeah. Thank you. Exactly. And then the next day, which is a Monday is we really learn about the bills that we're going to advocate for. And the Public Policy Committee, in partnership with AWHONN leadership, makes the decision about what bills will be advocated for. Typically, it's 3 bills. And sometimes it can be less than that or more than that, but that's your average number. We try to choose bills that are bipartisan so that it makes it a little easier to talk with whomever you need to talk with based on where, different sides of the aisle may land on that particular bill. And I think that's a really good approach. I think that's an important approach. And we go in depth about, the why. What is this bill? Why are we doing this? What is the need? And what are the talking points that you can bring forward? So you need data. Data drives all manner of decisions and information, and how people go, oh that's really important. And I think one of the things is that to understand about that is that not only do we go through those pieces of information for each bill, we typically have somebody speak on how to do this. What does advocacy look like? How, when you show up in an office to talk with the congressperson, which is not usually what's going to happen, but it can. You might be surprised. They might be there for you. In fact, this most recent time, our group, we went in to speak with a staffer for Maxine Waters, and she was there.
Oh, cool.
We had a little,
That's awesome.
day in the office right there. And it was fun. It's great. And I have heard stories of others that have had that same fun experience where they're actually going to meet with their congresspersons that represent them. Now, I am not a constituent of Maxine Waters, but one of our group members was. So it didn't matter. We were just excited because we're all representing California at the end of the day. And that was kind of fun for us to do that. But, the person that typically speaks on Monday, guiding us on, how do you do this? What does this look like? How much time do you have? How do you make an impact in a short order? And, what do you want to do here? That's really helpful. Especially thinking back to 2019 when I did this the first time. I was nervous and I didn't know what to expect. I didn't know how it was going to feel. And now I find myself years on here being someone that gathers the group together and gives guidance on how we're going to do this, how we're going to approach it. And I think that's one of the fun things is now that I've been a few times, people will look to me and say, well, what have you done and how has it worked? And, how do you make this happen? And just, the last time, what we ended up doing was we had 4 of us total, and we had 4 things that we needed to advocate for. So we each took a talking point, a focus, a bill. There were 3 bills, and there was also Medicaid, which at that point we didn't have all the details, but we knew we needed to speak to Medicaid. And we each had a talking point that we really focused on, and that makes it a little easier. Instead of one person having to speak to everything, you hone in on your part and you round it all out as a result of being part of a group that goes and speaks with the congressperson's staffers. And I will add that they are typically, this is my experience, they have been more than welcoming and open to conversation, ask lots of questions, and really want to understand what we know, what we think, what we feel, and most importantly, what are our stories that really bring this home to them. Because nurses we are natural born advocates, of course, but we have stories to tell to illustrate why this particular bill is so critically important. Yeah, and then day 2 is like going and doing it, like doing the meetings. Like, so yep. Day 1, get ready. Day 2, go do it. And then you have a debrief at the end.
The structure has, for the most part, I think, remained the same over the years. They do the intro kind of like how a bill becomes a law kind of thing, and give you, so you don't have to go into this experience with a lot of knowledge. You can kind of go as like a clean slate with just energy and interest, and they will, they give everything to us. So going in, getting an introduction on how the legislative process works, how bills are, how they're created, how they're proposed, and how it's amazing, how much work goes into them and how few of them actually get passed and signed into law. And, you kind of see how that happens how you go through this whole process. So learning how the bill becomes a law, and then getting the breakdown of the 3 pieces of legislation. And then, like you said, we spoke about Medicaid and Medicaid this year. the kind of the details, and they prepare us. I think they prepare us for everything. Not everybody is walking into situations where the particular legislator is, maybe going to favor the bill that we are going to be promoting. And so they prepare us, like you said, with talking points and, how to bring it back around. If there's a situation where we're not sure that they're going to be on board. And so typically they will tell us what we are asking for, right? So they'll tell us where the particular piece of legislation is in the process and then what we are asking for. So, for example, one of the bills that we were advocating for was the Preventing Maternal Deaths Act reauthorization of 2025, which was the Preventing Maternal Deaths Act reauthorization of 2024 and 2023. So it keeps getting, pushed down the road a little bit. But that bill had been proposed in committee. And so we were hoping that other people would sign on, as co-sponsors. And then when we would go, that was in the House. And then on the Senate side, when we were going to our senators, we said, well, this is where this piece of legislation is in the House. So keep your eye out for it. And then we would ask for you to sign on as a co-sponsor, when this, if and when it does make its way out of committee. So,
and Jamie, I have something to add.
Yes, please.
I did get the update that AWHONN on Capitol Hill has so far resulted in 2 additional co-sponsors for HR 2531, which I know you'll talk about, and for HR 1909, which is the Preventing Maternal Deaths Reauthorization Act of 2025.
That's good. That's great. Yeah. I mean, it's excellent. And I think it's, with that particular piece of legislation, they are reauthorizing a law essentially that was passed in 2018 and it was funded for 5 years. And, AWHONN and many of the other maternal health organizations were really instrumental in getting that passed in the first place. And that is a particular piece of legislation that helps fund maternal mortality review committees across the country. So it's a really important piece of legislation that we were advocating for, and taking our stories to our legislators to kind of talk to them about why it's important that they support that, and that why we as nurses support that as well. Amy, why do you think nurses should get involved in policy and legislation? Because I actually hear people say, occasionally, nursing is not political, and I didn't get into nursing to be involved in politics. Why is it important for us as nurses to kind of understand what's happening and to be involved?
Sure. So I would just say, and I kind of alluded to it earlier, nurses are natural born advocates. It's part of our Nursing Practice Act to advocate. So translating what we do at the bedside, advocating for the patients we care for, into advocacy around policy that impacts nurses and patients, to me, it's just it's an easy, direct route and kind of a no-brainer in my mind. And we do need to care because it is, in fact, legislation that can guide improved healthcare, improved outcomes for the patients that we care for, and improved working conditions for the nurses in healthcare, and not just nurses. Yes, I'm coming there as a nurse, but I work on a greater team. I work on a team that involves providers, and it involves social workers, and it involves frontline staff that may not be clinicians, but that need to interface with the public and the patients and their families that we all care for. We're a greater team, and we all need to advocate for improved care and conditions. That's It's that simple in my mind. And the way you can do that is at a local level for sure. That's a great way to get started, by the way. That may feel a little less intimidating than going to A1 on Capitol Hill, though I chose to dive in, and I think a lot of us like to do that. We're just like, get me in there. Let me at it. um, I think that if maybe you're a little nervous about that, a great way to do it is to start local and get to know what opportunities you have to make a difference locally. And when I say locally, that can be just in your own community, your district. And then you can move to maybe, the county, the state, and then federal. Like you can layer it up is kind of what I'm saying. So I just feel that, nurses drive these outcomes in so many ways. And, we need to care about advocacy, to drive those outcomes in the direction we'd like to see them driven.
Yeah, I totally agree with that. And, when I did my emerging leader program through AWHONN, the facilitator of the program is Miriam Young. And she always said to us, if you're not at the table, you're on the menu. And I think that that's it always stuck out to me because I have always tried to push for nurses being included and being involved, because we know what happens when people above us, even more when we're at the staff level, when we're working on the floor and people above us in the institution are putting together policies and procedures without our input, we get policies and procedures that don't fit our workflow, or they don't fit what we're doing on the floor, or they don't fit with the families and the patients that we're serving. So like you said, not only are we natural advocates, but we have really powerful voices and really powerful knowledge that people don't have when they are not working on our level. And the other thing that, I definitely learned from attending AWHONN on the Hill was that, like you said, you most of the time meet with your staffer, with staff people, the health staffers of the legislators, and they are younger, or at least younger than me, and and they definitely have policy-based knowledge, but they don't have the same knowledge that we have, and they look to us as the experts. So it is scary going in there at first, until you realize that they lean in when you start talking about what it's like to be a nurse and what it's like to serve patients and what it's like to serve families. And they look at us for that knowledge. And the nice thing that you can do is, if you continue to follow up, which is one of the things that they like us to do, after we, long after we come home from DC, if you follow up with those staff people, you can create a relationship with them so that they will remember you. Like, I've developed relationships within, some of our legislative offices that they remember me when I go back. And so that you can reach out to them on any health related topics, and just getting more comfortable with reaching out to those offices, I think makes everybody feel involved as constituents, and that our voices are valued.
Yes. Yes. I think that's a good point. One of the things that we end up doing as part of this experience is very potentially becoming a regular resource for a congressperson's office. The staffers may change and you may develop a relationship with somebody, but you start to develop that relationship with that office, and they know who you are, and they know what your experience is in and what your expertise is in, and they'll know to reach out to you, and you just continue to build that relationship and make yourself available. I think the nice thing about this experience is, again, understanding that yes, you can go to AWHONN on Capitol Hill and do this, but if you feel like you need to start small, you can. And you can meet with your congresspersons locally. They have local offices. And I think that's a really important thing to remember, is that might also be where you first get your in, if you will, is going to those local meetings as a constituent. And even though it may not be, the meeting may not be a topic that is about what you want to advocate for, it's your way to say, hi, here I am, one of your constituents, and this is what I do, and this is where my passion lies, and I'd love to talk with you more about how we could do XYZ about XYZ bill. It's a great way to do it, and you can do it locally if that feels easier or comfortable. But it's also what you can take home after going to AWHONN on the Hill. You have that same opportunity to follow up in that same vein too. So it's a great experience all the way around.
Yeah. Yeah, and I think one of the things that we're seeing now is the impact of constituents calling their representatives. So you don't even necessarily have to come to something in person, because there are people that are not holding in-person town halls and all of that, but they are still reachable. And they log when you reach out to a member of Congress, they log, who's calling and what people are calling about as something that it matters to the people that they are serving, right? So if they are getting X number of calls about Medicaid, and people concerned about Medicaid and Medicare, they're going to pay attention to that if they have a large volume or see an increase of people calling about that. So, just even just reaching out to your congressional leaders definitely makes a big difference.
Yeah.
I wanted to bring up, just so we can cover it, the bills that we were advocating for. We don't have to go too much in depth on them, but I just wanted to cover for everybody, just so they can get an idea of what the Public Policy Committee and AWHONN decided to address and to advocate for. So the first bill was HR 2531, the Workplace Violence Prevention for Healthcare and Social Services Workers Act.
It's really about ensuring safety in the workplace, and it is about having, essentially, it guides OSHA to create a plan that every facility across the nation implements, and put time parameters on that particular plan, and ensures that it gets implemented. And it's going to be things that would reduce the potential for violence to occur toward all healthcare workers. So it's not just nurses, it's anybody in the healthcare workforce, and typically inpatient hospital setting. I feel like this is an incredibly important bill to get passed. I think every facility across the nation needs metal detectors at every entry point that anybody goes through. That could be even employees, because I've also experienced that. This is huge. I feel like it needs to happen. And there is I'll use air quotes, a model law in California, but it hasn't dictated that metal detectors are needed. And it hasn't stopped all violence, obviously, since this is something that actually happened very recently. So there is a huge need for this particular bill to be enacted, and for OSHA to determine the terms, regulate it, enforce it, and put a timeline on it.
One of the other ones was Title VIII, the Nursing Workforce Reauthorization Act of 2025. And I know that one of the things that we learned about this was, I think they were reworking it a little bit on the policy end, right?
They're reworking it a little bit. And this was not just a reauthorization act, it's also an appropriations act. And just briefly, what is that? So authorization is different from appropriations. Appropriations is about the funding that allows the authorization to be enacted, essentially. So I think that's a simple way to put this. But this has been out there before, and I know that I benefited from it long ago and far away. I worked for a facility that was considered in an area that was an underserved area. So as a result of that, I was able to apply for getting my loans not fully repaid, but a good portion of them repaid, because I chose to work in a facility that allowed for that to be part of the process, where if I do this, they'll help me pay off this loan. But the other thing that it does is it really looks at ensuring that we have a pipeline of workers, nurses, advanced practice nurses, and as well instructors in nursing, in colleges, because that's the other piece, is that we need to make sure that we have instructors to bring new nurses into the into the workforce. So it looks at that. And this is something that we wanted to introduce in both the House and the Senate. The current appropriations expire the end of the federal fiscal year, which is a little different. And that ends September 30th of this year. And we're looking at, for fiscal year 2026, almost double the appropriation than what has been for this last fiscal year. There was a Dear Colleague letter that had been circulating asking for both representatives and senators to sign on that they would agree that this is something that we want to create as bills to be introduced both in the House and the Senate. So they were getting this dialed in. It's and I think my understanding is that a draft has been finalized, but we have not moved it forward now to actually become a bill. But this is the goal. And there's a lot of working parts, as you can tell, as I speak to this, that are required to make this go forward.
Yes. Exactly. And then the third piece of actual legislation was HR 1909, the Preventing Maternal Death Reauthorization Act of 2025. And I kind of spoke a little bit to that already, which is basically it helps reauthorize funding for maternal mortality review committees across the country, which we saw grow so much after the first Preventing Maternal Deaths Act was passed in 2018. So this particular piece of legislation would continue on the funding of that, and that funds CDC, the Centers for Disease Control and Prevention, to help support maternal mortality review committees all over the country. So almost every state has a participating maternal mortality review committee, and we were asking to have that, to continue that. So that was the last piece of legislation. And then we added on something new this year because there were a lot of concerns about potential cuts for Medicaid. So I don't know if you want to very briefly kind of talk about that, because we added that on as a fourth ask.
What I can say briefly about this. So the Medicaid is at risk of being cut. And it is also it's certain populations that are really potentially at risk of being harmed as a result of those cuts. This is rolled into a reconciliation bill, okay? And it's that is a special legislative process in Congress that allows certain budget-related legislation to be passed. And I'll leave it there. It's a special process that is followed, and it is part of the One Big Beautiful Bill that we may have heard about. There are a lot of other aspects to this bill. Medicaid cuts are in that bill, and I would add that I feel, and I don't think I'm alone in this, I feel that if we are looking at cutting Medicaid, the three bills that we advocated for are at risk of not going anywhere. Because we're looking at cutting a lot of resources relative to healthcare. So this is a very it's a big concern. It passed in the House by one vote last week, and it's now going to go to the Senate. And the Senate has already indicated that they will be making changes, and there's a lot of division about how they'll approach that bill. Whatever they pass, if they've made changes, it's going to need to go back to the House and get approved that way. So this could be volleying something back and forth until it gets agreed upon. But at the end of the day, the Medicaid cuts are very concerning. They harm very potentially the most vulnerable populations that we serve. Birthing women, children, those that live at or below the poverty line, those that are disabled. There's so many aspects to this, and I could go on and on about it. And, we don't have time, but it's very concerning.
Yeah. Yeah. And one of the things for, us as perinatal nurses is we know that like four in 10 births are covered by Medicaid in our country. And so it really significantly impacts the population and the families that we're served, and even more so in areas as we see, in rural areas where hospitals and units are closing their birthing units. Major cuts to Medicaid have the potential of worsening that crisis, which impacts not just people that are covered by Medicaid, it impacts everybody. If if your hospital local to you closes, even if you have private insurance, you're still not going to be able to go there and give birth and have get the care that you need for your family. So thank you for addressing that. And so what we asked when we went to our representatives and our senators was we asked them to advocate against any cuts to Medicaid. And so that's, going to be important in the coming weeks for us to continue to reach out and have our voices be heard to help protect healthcare for the families that we're serving. So thank you for helping address each of those bills. As we wrap up, are there any resources that you would like to provide to our listeners, anywhere that we could send them that they can find out more information about the legislative process, or if they're interested?
Sure. The easiest one and the most robust one is congress.gov. And that is a great resource. There's multiple ways to utilize that resource. You can sign up and create an account, and you can be notified of any bills that you are interested in following to get updates on how they're doing, where they stand. You can find out who your congresspersons are. So you're going to have 2 senators and 1 representative for every person in the United States. So we can all find out. You put in your zip code, I believe, is all you need. I don't know that you even need to put in your address, but regardless, you'll put in some information to identify who your people are. And then you can, from there, sign up to get emails from each of your senators and your representative to be up to date on what it is that they are either introducing as far as bills, what they're co-sponsoring as far as bills, any remarks they've made on any bills that are before committees, because that's what happens to bills. Thousands of bills are introduced every Congress, which is a 2-year period, and most of them die in committee and then they're reintroduced in another Congress. But this is going to get you very familiar with the process involved of legislation. There are also, if you go tooling around, there are also great introductory pieces of information about, well, what is the whole process? I don't know if anybody remembers, I'm just a bill on Capitol Hill, and I know I do. And it gives you, the less fun, more formal version of that. But this is a great resource for anybody wanting to really dive into legislation and understand how our government works and how our congresspersons are supposed to be working on the behalf of the constituents they
Yeah.
serve. So
Yeah, that's a great resource. And for our, to put in a plug for AWHONN, we have a great director of government affairs, Seth Chase, who, manages the whole AWHONN on the Hill process, but also is out there advocating for AWHONN and all of the legislative work. Every day of the year, every other day of the year, other than, when we're down there with everybody on AWHONN on Capitol Hill. And if you also go to AWHONN's website, they do have a legislative and policy section where they can learn more about the process and more about the bills and legislation that's being selected for advocacy. And then again, the Public Policy Committee is a great national committee, but the state chapters and sections also have people who are active, like you, on the state and local level for, to learn more about. So nurses have a lot of different options and a lot of places that they can go to learn, but a lot of places they can go to use their voice as well. So any last minute add-ons?
I will just add that my Northern California counterpart and I last week did a session for our California section to go over, debrief, what our experience was and how it all went and where things stand, and just get our California section folks up to speed. So, and we're going to do another one in September. So that is something that you may find that at your AWHONN more local level, either chapter or state section level, that they offer these sorts of things. And I think it's a great opportunity to learn more and, dip your toe in the water if you're interested in this good stuff. So.
Yep. And there's a session at convention by, I believe, the Public Policy Committee. Yeah, yes, it's always a great session. I try and go to that every year. Thank you so much for your time and for flying all across the country, every time that you've done this. And I was so happy to be in DC with you this year, and I can't wait again. Can't wait for it next year. It's probably my favorite AWHONN event of the year.
I would agree.
I
really enjoy it.
It's a good time. So thank you. It is.
I love it,
Yes.
So
it definitely is. You feel very, very useful. So yeah. So thank you again for your time. And Bria, I'm going to turn it back over to you.
Oh, this was really great. I learned a lot, and I wanted to pull out a couple of really great insights that you all shared. And so one is simply stated, nurses drive outcomes. And you all mentioned that nurses have powerful voices and are looked to as experts, especially by these staffers in the congressional offices. So for all of our listeners, I hope that there was a lot of information shared that you can pull from to get connected to AWHONN, to the Public Policy Committee, thinking about traveling to DC for AWHONN on Capitol Hill, and taking advantage of building these relationships at varying levels, so local level, county level, and the federal level. You can visit awhonn.org/podcast if you'd like to read Amy's full bio and utilize the resources that she shared today. You can also subscribe, watch, and re-listen on YouTube and multiple streaming platforms. We appreciate your time and hope that you recommend our podcast to a colleague or friend. And also you can reach us and let us know about your listening experience. We hope that all of you stay safe, and we look forward to connecting again on another podcast. Thank you.